I was born has given me an award. People normally don't recognize me. I was not expecting one. And, like we say, we never know what it comes out. So I want to start by saying, good morning, Canada or North America. Good morning, Europe. Good afternoon, Europe, and good evening, Africa, and of course, Asia. Yeah. Thank you so much for a very nice introduction. My friend, Dr. Ram. Thank you very, very much, Madam Lady, the chair lady, Dr. Alima. Thank you for welcoming us today here. I just can't believe that I was given such a good subject. Mine is very easy. Look back at 2020 and we go forward with the hope that everything will be okay. Yes, we have a right to be optimistic, but at the same time, we also have to be realistic. I just can't believe how time flies. And I have to thank God that we are alive now, that most of us are alive now, and I'm alive, and my family is well. I just want to thank my family, my wife, for the support she has given me. And for the 3 kids, any man would ask for a woman. We are at this point at a junction where we are closing a chapter of individualism and opening another chapter of collective responsibility, because we realize that we are all interconnected. You can imagine now, as I'm speaking, we are in different continents, but we are all one people, because that is what makes us unique and strong. We are only strong when we are together. If there is anything COVID has taught us, is that we need each other. And therefore, since 2020, we have had our own triumphs and struggles, and yet unique in many ways. It is a period that I can term as COVID era, from 2020 until now. Well, I don't want to take too much time on your time with the theory into this gathering. I would like just to discuss some few things here with you, and I hope I have you see, can everyone see it? Hello?
Yes.
Yes.
Can you see the video?
No.
No.
Can't see.
I will share the screen. Okay. Oh, okay. Can you see it?
Yes.
Now, for those who don't know me, actually, I would just want to refer them to our website there. You have my bio, you have the bios of my colleagues. We work there. When the COVID started in 2020, I used to work here. I also work in Canada. And I also, at some point, I worked in Kenya too. But I want to say one thing, that over the years, I've seen patients. Patients are patients. They are all the same, whether they are in Asia, North America, Europe, we are all the same. COVID pandemic, as my colleague has already discussed about, is something that everyone knows at the moment. There's no doubt, there's no one I can explain or give a definition of what COVID is. COVID-19 is a disease, and SARS-CoV-2 is a virus. These two, they know no race or ethnicity. They don't discriminate. And I was discussing with some people, like, the reason why COVID-19 has had such a big publicity in today's world is not because it is only the first one disease that is killing people in the entire world. It is just because it doesn't discriminate. It kills everybody. You know, that is why it has publicity. Now, we all know that it mutates. And that's the reason why we have there were another type of virus in London, South Africa, everywhere. And it affects our people who are vulnerable, like the old people, people with diabetes, with respiratory diseases, with the cardiovascular diseases, such as myocardial infarction and everything. My colleague has already discussed on how it spreads. It spreads fast. It has saliva, through nose, through coughing. That is something that we always know. And this one is, everyone knows, and my colleague had already discussed about that. But at the same time, what we should be conscious of is, like, as we go forward with the managing COVID-19, we must make sure that we restore science to its place. We are in an era where we need scientists. Those are the people who will guide us. That means that we need medicine that we can verify, that we can rely on, that we can hope that at the end of next year or the coming year, that the scientists will now tell us, look, we have found a cure. It is okay, everyone. We can now lead our lives. It is also true, and this is what you should know, that there is no point are we going back to where we were before. We, for sure, are going ahead, but we are not going back. That is the reason why some of us who are in our foundation, in the Keyboards Foundation, we decided that we should not be idle. We should not wait for others to do things for us. We must do them by ourselves. And the reason why we did that is, like, we have to take responsibility. We have to take responsibility, because it is only when we take responsibility in each and everything we are doing is when we can advance together. A child in India who is sick, a child in Kenya who is sick, a child in Nigeria who is sick, a child in France who is sick, a child in Canada who is sick. They are the same people. And as a doctor, it is my responsibility to make sure that those people are doing good. You understand me? And that is the reason why, when we came up initially with this foundation, Keyboards International Foundation, we wanted to start from a part of the world that has nothing, that people don't have hope. We didn't have much. We had no resources. We didn't have people who are willing to volunteer. But with the time, I thank God that we have had people volunteering, coming in, and doing what any human being can do for another human being. That is caring for another human being. I'm probably not going to get in detail over the scientific aspect of COVID-19, because I don't think that is my subject. I think that is a subject of somebody else. Mine is to speak, just go to the future. We took, for example, Kenya, and we said, look, let us look at this country. It is a smaller country. It is an African country. It's not actually an African country, because no country now these days is defined by ethnicity or race. It is a country in the south of the Sahara, a poor country. You can see the number of COVID cases, the way they are going up. But there seems to be nobody looking at this. And there seems to be no solution designed to make sure that this is controlled. And that is the reason why our members and Keyboards Foundation decided that, look, instead of sitting sideways, why can't we go and visit people, communities like these ones here, that the ones you are seeing, like in Guyana, in Homa Bay, to see what we can do. We designed a program to make sure that, look, we will provide people the basics, not to be rich, but the basics for people to survive. That doesn't mean that we cannot do much, but it just means that in everything you do, we must start from somewhere. And we started this program of giving people masks, as you can see here. We also designed a program to educate them on how to use the masks, to make sure that it is not only that, but they also have other precautions that they take, like for the physical contact, like, for example, the way of living, the interaction with the people. And I will tell you that we have actually done much over the course of some few months. We have made sure that around 800 kids in schools have the masks. They know what COVID-19 is now, and they know our program. That doesn't end there. It is not going to end there. It is a project that we are going to continue with in the coming days, coming months, coming years. And we hope that at some point, others will join us. Those who are sitting on the sideline, others will join us and we work together. It is not the only thing that we can do, but at least we must recognize that we have to care for each other. You can look at this, if I bring you here and look at this boy, young boy here. I'm sure you are, if you are seeing, we will do research to them to understand where this disease is coming from. It is also true that to have a study that is credible in today's world, you just can't pick a subset of patients or of subjects from a particular region. Say, for example, pick from France and do a study and then say, okay, let me generalize the results. That will bring some questions east-west. It is scientists have to discuss. This is from Asia, take some from Europe, take some from China, from Africa, and then do a study, scientific study. This is when you will know that actually the data you will present will be representative of the population. That is a fact. And that is actually a fact. Nobody can dispute that. The reason about saying that is that we are becoming a village and we must know each other. That is it. So what we are trying to do in this, I'm not saying that this is the only project that we can do. Like the others we do, we can help do operations. We can even help give people food, though that one is in the downline, but that is also another project. We in our foundation are not going back. We have realized that in the health sector, there's so much to do, especially for empowerized communities in remote counties or remote countries. This also could be a model of providing healthcare services. It should not be the only one. There are others too. This also has to go with the resources. Because when you have resources, you have to use them for the common good. when we are talking of diagnostic mechanisms, like for example, when you're talking of the diagnostic mechanisms, for example, labs, machines, those ones are important. But I will tell you for sure, as somebody who has lived in an era where COVID-19 is ravaging people, it is still there. Without the diagnostic machines, you will be in an empty talk. It will be an empty talk. You can't treat people. You have to have that. And this is where our foundation is focused in. I want to be optimistic anyway by saying, because I promised that I'm not going to take long, I want just to be optimistic and say that much as we are going to do, I hope we can do much, and we should do much. And I'm therefore, on behalf of all our members of our foundation, I want to thank all our volunteers for embracing our vision of caring other people. I want also to take this opportunity to thank the scientists who have joined us from all over the world, whether they are in Hong Kong, whether they are in India, whether they are in Korea, whether they are in North America, in Europe. I want to say to them, thank you for your love and support. And thank you to know that the vision we have started, I think we will have to continue. And I hope we will continue. For that I say, and for this day, I'll only say one thing, that there's much we can do together, and we must do that. Thank you. Thank you so much. Thank you so much.
Thank you very much. Thank you, Dr. Ambros. It was really very touchy. It was really very emotional. And it was from the mouth of a visionary who can see that the basic health facility is provided to all the human beings, to whatever country, to whatever nation they belong to. And we all are with you, and we all are with your mission. Thank you very much. May God bless you.
Thanks.
Thank you. Your vision and mission will take lead. Because of the International Doctors Day, we have huge community, and we can able to support as much as possible from our heart and soul to make the people, the human well-being and the wellness for everybody uniformly available. Thank you so much.
And now I would like to invite Dr. Ram. Dr. Ram is the founder and the managing director of ACE International Singapore. He is holding doctorate degree in biomedical research area with more than 20 years of experience in research and development. He is supporting knowledge and technology transfer to upscale business strategies and procure investments, research, innovation, and product development through institute and industry partnership establishment. He is passionate in delivering keynote speeches and lead talks in international conferences and symposiums, conducting capability workshops, seminars, training, mentoring, and coaching for institutions, industries, companies, and associations. I welcome Dr. Ram with the request of keeping the constraint of time in the mind. Dr. Ram, over to you.
Yeah, actually, keyboards need to unshare this thing. Stop sharing.